For me personally as well, so maybe just briefly my background. So I have been working in diagnostics for most of my career. So I have a training in pharmacy and pharmacology, but then went into public health and into research. So I've been working in TB for more than 20 years. Initially on the technology, the R&D side of things, but for the last 10, 15 years has been really working with ministries of health in different countries. So I'm based in South Africa, in the African region, but also in the Asian region. More looking at the systems perspective and where do you need capacity, how can you expand the testing capacity to reach patients where they are and improve services. So many years ago I was part of the first study to evaluate gene expert, so in Uganda, in Africa. So to see the evolution and to come somewhere like this and see the services that you're offering and the kind of care that patients can get coming here, and to know in Pakistan how critical the private sector is to be able to reach the targets for TB. It's pretty exciting for me personally to be able to come here and to hear about what you're doing. And yeah, in terms of, the little bit we've been able to see, obviously the attention and the linkage and how you're working seamlessly with the TB program, with the government sector, I think is, there's a lot of, our job here is to come for an evaluation, but for me it's also like, what are the lessons we can take away? So I think there's a lot we can really learn from, what we've been able to see and hear from you. So just really a heartfelt thank you for taking the time and allowing us to come and see the work that you're doing here. And I think I'm also excited to see the potential. It seems like you already have plans to do so much more than what you already do. So I think that can only be, a real positive to contribute even more going forward. So, yeah, thank you.
Madam, you have seen many countries, but the Isra campus, can you give some glimpse how you have observed this campus, a very beautiful, spacious, and I think accelerating campus, or
yeah,
how you say?
Yeah, I have indeed been privileged to visit facilities in quite a number of countries. It's my second visit to Pakistan, and indeed I think the facilities here, the campus itself, but also the fact that you're serving not only the patients in the private sector who can afford the services that you're able to offer, but also the less privileged patients, that you're providing also a very high quality services for those patients, particularly those suffering from TB. So I think this is it's very exciting and humbling to see the kind of services that you're offering here. On both sides of this partnership, the patient is really at the heart of what is driving this, which is really, quite humbling to see. And I think I really enjoyed hearing about how the partnership came about, because firstly with TB we're used to being patient, right? It's a very slow disease and things have taken a long while to change. So I kind of heard about, on both sides a real desire to build the partnership, but also the fact that things don't happen overnight, and so this long-term
finding places that are able to take advantage of the technology. But also then work well with the other partners. So I think that's the other thing is we see a lot in sectors that there's a difficulty between the interactions between one institution and another. So to learn and understand how well your institution, your team works with the PMDT Center here in Sindh Province, and able then you're facing here, because the challenges that you're facing here are certainly going to be faced by others. So by being honest about the challenges, we can then say, okay, we know you are not alone in facing it. So that's why we want to hear those challenges.
Today, there is a lot of improvement in the diagnosis as well as in the management. And nowadays, patients usually don't die, only except those who leave the treat or who are having MDR and did not respond to treatment. While since treatment of MDR is quite costly, but now with the help of Green Star, we will be giving them free of cost, and this will improve. Main thing is prevention. For that purpose, they need vaccination right at the birth and afterwards. That's the best. It is always better to have prevention rather than cure. But unfortunately, due to lack of education and lot of big area and people are not vaccinated properly, and then they end up with this type of disease. But once we prevent this disease, then hopefully the disease will be eradicated completely. Inshallah. And as you know that this disease exists even in Western world. It again re-emerged after the immunocompromised like HIV infections.
And subsequently after the COVID.
Yeah, after the COVID again. So there's a resurgence of the disease. But hope that the things will be under control once we take it really scientifically with modern gadgets.